Hi, I'm Elena Agapie from UC Irvine, and on behalf of my collaborators, I'm excited to present our paper on collaborations between HCI and health researchers using a team science perspective. Design and human-centered computing approaches are increasingly used in health research. Looking at the funding of health research from the US National Institutes of Health, there's been an increase in the funded research every year that uses human-centered design. Over 500 health proposals were funded with at least $200 million in the last 10 years. And all of these involve human or user-centered design. And this also includes starting to fund research centers and training programs that aim to bring together HCI and health researchers. To understand collaboration between HCI and health researchers, we use a team science lens. Team science is a research field that studies scientific collaboration done in teams and how teams work together to achieve their goals and objectives. In this paper, we'll take a team science lens to study challenges and opportunities for supporting teams that have HCI and health researchers. So the success of teams-based scholarly work depends on a lot of circumstances and events. At different levels of the ecosystem in which that research is produced. The success depends on how well aligned each of these layers of the ecosystem are. For example, for a science team to create and define knowledge, it is dependent on the abilities of its team members to execute tasks, their interpersonal skills, their training, but at the same time, the productivity of the team, even the existence of the team, is impacted by the support it receives from institutional leaders or research funding agencies. So there are a lot of things that need to be aligned for teams to be successful. In this paper, we aim to understand the challenges of early and mid-career HCI and health researchers, the challenges they encountered when they're in leading roles collaborating together. And how do they go about resolving those challenges? We interviewed participants, HCI researchers from 16 different institutions, including art universities and liberal arts schools, who worked on creating technologies with health researchers using user or human-centered design processes. In this research, we use Hall's model to highlight how research integration is achieved between team members at different levels of the research lifecycle. You can read more about this model and the differences between different stages of research in the paper, and I will highlight a few of the findings. So at the first stage of research, team members are developing research ideas, are defining the problem that they're going to work on, and starting the collaboration. And what we found at this stage was a high load on the individual to find collaborators. Some people spend years to find one, putting in extensive effort. For example, one participant cold emailed people, had their department chair and dean introduce them to health researchers, had a former PhD mentor introduce them to researchers, and still spent a couple of years until they were able to find someone as a collaborator. In turn, participants found it useful when there were structural programs that made it easier to find collaborators, such as seed grants, or even doing postdoctoral programs. But these are not always available. At the next stage, researchers conceptualized research. And at this stage, a major challenge was that health researchers had misperceptions of what the HCI researcher role was. For example, this involved thinking they were a practitioner who just made design tools or a programmer who built what they're told, or usability tester who evaluates the system after it's built. This led to the collaboration either not starting or ending or creating tensions in the collaboration. Next, researchers implement research that they conceptualize. But at this stage, HCI researchers found But there were method misalignments. For example, health collaborators not necessarily understanding the role of qualitative data or design methods not being taken seriously, thinking these are anecdotes or being creative. But some participants found ways to mediate such misunderstanding through artifacts showing end results or technologies, showing technologies they built in the past, or how methods like sketching are useful at other stages of the research process. When it came to engaging in translational research, researchers taking the research findings and applying them to concrete problems in practical settings like clinical settings, our participants stated that this was not as valued of a contribution at their stages in their career and would compromise on it, even if they were interested in doing this work. Participants also felt like they were not trained in translational methods. So such challenges are common for cross-disciplinary collaboration across different fields. But fields like team science have identified best practices to address these exact challenges, particularly at the systemic and institutional levels. Team science recommends creating a training environment in which scholars are immersed in cross-disciplinary work from the doctoral levels up, including when they are faculty. Some training institutes are already starting to develop with this mission. These models can provide learnings for how to scale and support a larger part of our research community. Another recommendation is to support and reward translational work as a scholarly contribution. Some scholars like Anchor or DOP and colleagues have been writing papers in health informatics or implementation science translating methods. So creating translational toolkits, shared vocabularies, and artifacts that illustrate HCI methods can support better collaboration. There are multiple team science toolkits to support communication between team members at different stages of research, their goals, responsibilities, approaches to research. We also encourage flexibility in publication of research, where paper authors acknowledge the role that different research team members played in creating that research and implementing it, where in the research life cycle different researchers participated and how they influenced the designs that were created. And to also consider how the research can be translated to actual clinical settings. Read our paper to learn more about the different levels of research integration in teams, more findings and discussion points. Please reach out if you're interested in the use of human-centered design approaches in health research.